Mental health translates to cognitive behavior and emotional well-being. It's all about how you think, feel, and behave. You might use the term mental health to explain the absence of a mental disorder. Mental health can affect daily living, relationships, and physical health. Looking after mental health can preserve a person's ability to enjoy life. Psychological conditions such as stress, depression, and anxiety can all affect mental health and disrupt a person's routine. Although the term mental health is a common used term, many conditions that doctors recognize as psychological disorders have physical roots. In this video, we will try to explain what some people mean by mental health and mental illness. How do you view your overall health? Do you feel like you take your health for granted at times? What is your approach to your overall health? Do you even consider that your mental health is as important as your physical health? As we go throughout life, we sometimes take our mental health for granted. A lot of times we consider that this is the way that I've been and I'm fine with that. Being able to view yourself from a different perspective and challenge your approach to certain situations may be an entry point to fortifying your mental health. This can also help to change your outlook on your physical health by not just trying to be healthy because the doctor advised you to become more active. Learning to consciously give yourself better options and working towards healthier goals is firmly linked to good mental health. As soon as you can see where changes are needed in your life, you can start to move in a direction that will allow for change. Reinforcing your mind to grow in the proper direction is needed to show a more structured way of thinking and approach that you may have never considered. Your mental health is important to your stability and the way you function in society. According to the World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. The World Health Organization stresses that mental health is more than just the absence of mental disorders or disabilities. Peak mental health is about not only avoiding active conditions, but also looking after ongoing wellness and happiness. They also emphasize that preserving and restoring mental health is crucial on an individual basis as well as throughout different communities and societies the world over. Here are a few risk factors for mental health conditions. Everyone is at some risk of developing a mental health disorder, no matter their age, sex, income, or ethnicity. In the U.S. and much of the rest of the world, mental disorders are one of the leading causes of disability. Social and financial circumstances, biological factors, and lifestyle choices can all shape a person's mental health. A large portion of people with mental health disorder have more than one condition at a time. It is important to know that good mental health depends on a delicate balance of factors, and several elements of life and the world at large can work together to contribute to disorders. Researchers have explained the difference in the availability and quality of mental health treatment for certain groups in terms of modifiable factors, which can change over time, and non-modifiable factors, which are permanent. Modifiable factors for mental health disorders include socioeconomic conditions, such as where the work is available in the local area, occupation, a person's level of social involvement, education, and housing quality. Non-modifiable factors include gender, age, and ethnicity. Studies list gender as both a modifiable and non-modifiable factor. Research has found that being female increased the risk of low mental health status by almost 4 times. People in a weak economic status also scored highest for mental health conditions in this study. There are some biological factors that could also put a person at mental health risk. Having a gene with links to a mental health disorder, such as depression or schizophrenia, does not guarantee that a condition will develop. Likewise, people without related genes or a family history of mental illness can still have mental health issues. Mental health conditions such as stress, depression, and anxiety may develop due to underlying life-changing physical health problems such as cancer, diabetes, and chronic pain. The most common types of mental illness are as follows: anxiety disorders, mood disorders, schizophrenia disorders. Here are a few of the early signs of mental health issues. While there is no physical test or scheme which reliably indicates whether a person has developed a mental illness, however, people should look out for the following as possible signs of a mental health disorder: withdrawing from friends, family, and colleagues, avoiding activities that you would normally enjoy, sleeping too much or too little, eating too much or too little, feeling hopeless, having consistently low energy, using mood-altering substances, including alcohol and nicotine, more frequently, displaying negative emotions, being confused more often, being unable to complete daily tasks such as getting to work or cooking a meal, having persistent thoughts or memories that reappear frequently, thinking about causing harm to themselves, or often hearing voices and experiencing delusions. There are various methods for managing mental health problems. Treatment is highly individual, and what works for one person may not work for another. Some strategies or treatments are more successful in combination with others. A person living with chronic mental disorder may choose different options at various stages in their life. Be sure to work closely with a doctor who can help you identify your needs and provide you with suitable treatments if you find out that you are at risk. Treatments may include psychotherapy or group therapies, medication, and even self-help. A person coping with mental health issues will usually need to make changes to their lifestyle to facilitate wellness. Having a good support network, whether via self-help groups or close friends and family, can also be essential to recovery from mental illness. Determining if you have a mental illness could be crucial to your preservation, which includes your physical health. Don't be afraid to ask yourself the tough questions that need to be asked. Be sure to secure your mental health. I hope you find this video helpful. Thank you for watching. Please like and subscribe below. Hit the notification bell so you can stay up to date with all of our latest videos. Remember, your mental health is not just the absence of a mental health disorder.